Shalyn was funny. She was so gregarious and full of laughter. Shalyn was living in Kansas City. She was in school there. She decided to come back home to Las Vegas. She was so excited. She drove straight from Kansas City home to Las Vegas, 22 hours. And when she got here, she kept telling me, "Mom, look at my leg. You know, it's red and it's swollen." Unfortunately, I was on the way out at that moment to a business meeting. And, she's 22 and she's just moved in. I'm like, "I'll just see you when I get back. I'm so excited you're here, and make yourself feel at home and comfortable, and I'll see you in a week." Soon after I got to the retreat and I was in business meetings that I got the first phone call. She went to the emergency room with my husband. And, the first thing they asked her when she got there was, "Do you have insurance?" And Shalyn replied, "No." This sealed Shalyn's fate. Finally, they called me again. And I'm like, "What? Why are you calling about this?" I'm like, "Listen, just be seen. I'll take care of this." And like most Americans, I thought, if you go to an emergency room, they're going to see you. My husband told me that at one point, they're like, "It's going to be really expensive. You can leave now and it won't cost you anything." And Shalyn's like, "No, there's something really wrong with my leg." And so she stayed. The next call I got from Shalyn, she's crying. And she's like, "Mommy, they're not helping me, Mommy. I keep asking him for some testing. I keep asking him for something for the pain. They told me that I need to go get insurance and see a specialist. They're not a doctor's office." Shalyn was Black. She had sickle cell trait. She was on birth control. And she had just driven 22 hours on a torn ACL that was healing. And she had a red, swollen leg. This is one of the things that many nurses and doctors, including my sister who's an RN, told me that should have been an immediate signal that we need to do testing for a blood clot. And let's tell you what that entails. We're not talking about hugely expensive tests. We're talking about a bedside ultrasound would have saved my daughter's life. Shalyn needed to go back to Kansas City to finalize paperwork so she could start school on time. Because we didn't know she had a blood clot, she got on that plane. That night, apparently she was on her phone Googling signs of a heart attack. And that morning, my husband made her favorite meal, which was grits and bacon. And then he said, she started grabbing her chest and saying, "Daddy, please call 911. I can't breathe." And he said she kept repeating it, and she was wailing and agonizing and writhing on the floor and holding her chest. And he called the ambulance, and he got her in there, and there was complete fear on her face. My daughter's last conscious moments were in the back of an ambulance by herself, in extreme pain, with sirens going off, dying an unnecessary death. I will never forget how I felt when I walked into that emergency room. She was actually in ICU by this point. The room smelled of blood, and every time the ventilator would push oxygen into her, her head would fly back and her eyes would flutter open a little bit because she was over-breathing the vent. I remember saying, "What's going on?" And they're like, "Well, she has a massive clot from her ankle all the way to her groin." We're not talking about a little clot. We're not talking about something they would have been able to detect. We're talking about a massive clot. They have pumped her with so much blood thinners that she is hemorrhaging from every orifice in her body. My baby girl was hemorrhaging out of every orifice, and all I could do was sit there by her bedside, and every time her eyes would just flutter open a little bit, I'd be like, "Shalyn, fight. Fight, Shalyn. You get through this. You're too young. You have too much to live for. Fight." I did this for hours. At this point, I knew injustice had happened. My sister had started putting the pieces together, and the doctor had said, "What do you mean they didn't do an ultrasound on her leg?" And I also talked to my husband about it, who is an immigrant from Brazil. And I remember the moment that he said, if she had been in Brazil or even Saudi Arabia, she would have had a better chance of getting care than she had in the United States in that moment.
A mighty woman stands as the icon of the American dream. Her name is Mother of Exiles, and she calls to us still. Give me your tired, your poor, your huddled masses yearning to breathe free. The wretched refuse of your teeming shore. Send these, the homeless, tempest-tossed, to me. I raise my lamp beside the golden door. And yet, in a typical year in modern America, approximately 68,000 people will die due to lack of adequate health care. 500,000 families will file for bankruptcy due to health care costs, and 240,000 people will die in hospitals due to preventable injury. That's the equivalent of one fully loaded 737 crashing every single day. It's time for change. It's time to heal. Is it possible? Are we ready? That depends on us. We the people. Here. Now.
Let me show you.
He saw this cat and he was like freaking out. I am knitting.
I know, I love this.
With round needles, which I haven't really done a whole lot, but I've done it before. You have these needles, they can either be metal or wood, and then they have this little plastic cord that goes around and it connects it to the other needle. And then the stitches can go on the needle and the cord. So you can knit it for like hats or, things that are round.
My sister, who lives in Canada, was visiting for Christmas, and she was knitting, and I just kind of wistfully looked at her work and said, "That looks so amazing. I wish I could do that." And she said, "Well, you can. I can show you, and there's so many things you can learn on YouTube, and I think it would be really good for you, Laura. I think you'd find it really kind of grounding and soothing and relaxing." And so I did. A few years later, I'd been knitting for a couple of years. I knit some of those pussy hats, and it was really neat. You could fill out, you could label your hats, and you could put your name on it, and you could put what are the issues that matter the most to me. So the hats that I sent to the DC Women's March actually had Medicare for All. So my Women's March hats had "We Need Medicare for All" on them. After that day of action, it was all over, social media and the news and everything, obviously. All of a sudden, these flashes in my mind, kind of flashing back to the aerial views of all of the pink hats. And I just started thinking, we need to be crafting for Medicare for All. And then I started thinking, well, what kind of a hat? We should do berets because they're a bit militant, and I'm a veteran for peace, and beret would be the sort of revolutionary type of headgear that we need to craft for this.
The red beret is an icon of a warrior, but also at the same time showing with the red the healthcare industry. Unity, solidarity, and the imagery we project by all of us wearing red berets shows that no one fights alone.
Our whole thing is, let's do this together because we need, all hands on deck, so to speak.
We're spreading the word that Senator Annette Cleveland has never let a single payer bill out of her committee.
and she has taken massive amounts of money from private hospitals, big pharma, and the insurance lobby. So we're pasting these all up around the farmers market and public places here so that people can understand that she's representing the pharmaceutical lobby instead of her constituents. So that's what we're doing.
One of the many strengths, I think, of coming at this from a creative modality is that there is something good and holistic about the labor of love, of sitting down to create with your own hands.
By getting involved in healthcare justice as Red Beret, I feel like I'm more human than before. It just makes activism accessible to everyone. You may not be physically out there yourself, but your berets are out there with people. And that's the beauty of Red Berets.
Clearly, we've had decades and decades of organizing. Something hasn't quite worked. Something, we need to get very, very creative.
Before my husband and I were married, we lived in New Mexico. We got pregnant, and New Mexico, this is before the ACA passed, but I think it's probably still the same. The insurance companies allowed a small Medicaid expansion for pregnant women, and then their children, if their children were born. But as long as the child was still alive, the child would be covered. So because I made a little bit too much money to be on full-blown Medicaid, I was working at a shoe store, I wasn't able to qualify for full Medicaid. So I got on this program that allowed my pregnancy to be covered, essentially. One day, I think I was about 3 months along, I started having severe cramps, and I went to the doctor. And they gave me an ultrasound, and they said that I was having a miscarriage. What I could do is I could have what's called a DNC, which is I don't think it would be considered surgery, but it's a way to move the miscarriage along so you don't have to go home and go through basically labor. But it would cost $3,000 because my healthcare coverage only covered my child. Well, my child still had a heartbeat. So I said, I don't have $3,000. So I went home, and it took about 4 days, and I had a miscarriage. A few months later, I get a call from the hospital's bill collection agency telling me that I owed like $400 to the hospital for the ultrasound, where they told me my baby was no longer viable. I think back to it, and one of the hardest parts was talking to the insurance collector, because he even broke down in tears. He couldn't believe that he was having to call me to tell me that I had a bill because my baby had died. And that's one of the reasons why I really am passionate about this, because I don't want any woman to ever have to experience something like that.
What is our situation?
All right, aliens, this is going to be a little difficult for you to perhaps wrap your mind around, because our healthcare system doesn't make that much sense.
Healthcare systems on planet Earth can be separated into 3 categories. Most countries have healthcare systems where care is both free and universally available. The second category are nations where healthcare is free but not yet universally available. And then there are the countries where healthcare is neither free nor universal. Among these nations, the United States is an odd company as the wealthiest nation on Earth and the country that spends the most on healthcare.
We are governed in American healthcare by the for-profit interests. It's a system that's designed to maximize profit, and it does it very well.
Our healthcare system is a profit-driven business. The conversation, the main driver is, How do we increase our customer base, and how do we do it for cheaper? How do we increase our profit margin?
We have $4 trillion in the American healthcare system annually in the United States, which is by far more than any other country. On average, twice as much per capita, or as a percentage of the gross national product, is spent on healthcare in the United States. And that isn't driven by the fact that Americans are sicker and need more care. It's driven by the fact that as much money as possible is siphoned into the system, so as much profit as possible can be extracted from it. That is the underlying ground principle of American healthcare.
I come to work, have people who are sick, they have a problem that I know I can help them with, but there's always a cost obstacle. The most common question I get asked as a doctor, the most common question by far, is how much is this going to cost? Of course, people ask me about side effects and other things, but the absolute most common question that I hear over and over again all day long is how much is this going to cost? And because we have all these different healthcare plans with all these different copays and deductibles and tiers, et cetera, I never know how much it's going to cost. It depends on so many factors. You and your neighbor could have the same name of a plan, but pay different prices and have a different deductible depending on what your employer decided to do. So this is something that is affecting everyone. I'm a doctor. I still don't like going to the doctor because of concerns about cost. I don't like getting surprise bills. I don't like going and getting the service and not knowing how much it's going to cost until after the fact.
I'm Leah Perkle.
And I'm Steve Perkle. And to be honest, we were doing this fight before we even joined. Actually, before our story happened, we were already part of the Medicare for All fight. It's just we ended up having a story that kind of fits in.
Which we honestly never thought we'd be in that situation. It really hit home what we had to, because what we went through was pretty devastating.
Yeah.
Want to say when it started?
Well, we were going to a meeting about homelessness and housing affordability. And we were at the meeting, and my wife and my son thought I was falling asleep during the meeting. But I was having a heart attack. So we're at the meeting, I'm having the heart attack, and I'm not saying anything because I know I don't want to go to the hospital because it's going to be expensive, even though we had the insurance.
We kind of got in an argument that
night.
Yeah,
we did,
because we had to go to the hospital.
We went home, she was hungry, I wasn't, and she's like, what's wrong? And I go, I think I'm having a heart attack. And she's like, no, quit joking, because I occasionally joke. I wasn't joking, I was having a heart attack, and so...
I actually had the cardiologist come in to me, and he's like, we can't wait, we don't have time, you can't worry about the insurance company, you have to let me do my job, because if we don't do it now, he's going to die.
I find out like a day later that I didn't have a triple bypass. I actually landed a quad, so...
It ended up being, what, $135,000?
Yeah, $135. Plus, there were 2 ambulances billed, so $1,200 for one ambulance they paid $200 on, and then over $3,000 on the second one, which they didn't pay anything on.
After months and months, they said, you make too much, we can't help you, we can't write this off. We're going to have to turn you over to a collection agency, which is where we are now.
But they did call me up one day and tell me that if I paid it off 100% in full right now, they would give me a 30% discount. So that was very nice of them.
So it would have been about $75,000.
Oh, over that, yeah.
Yeah, which we didn't have.
But, you know, yeah, we didn't have that money, so why would they even make an offer like that? It was kind of insulting to us.
I mean, if we had that money, we would have had better health care.
Yeah, exactly.
The healthcare system in America is really a class system. If you are wealthy and you are or middle upper class, you're probably going to be okay, you know. But if you are a poor or working class person, many people just hang on to their job strictly so they have healthcare.
America, which is the richest country in the history of the world by some metrics, has an employer-based healthcare system, wherein you get healthcare through your employer, which means that if you no longer become employed, you no longer have healthcare.
To be honest with you, I was not knowledgeable about insurance, single payer, and all that. But coming from Japan, of course, like we have universal healthcare in Japan. So it was kind of a no-brainer to me. Like, yeah, why don't we have that in this country? We are perfectly capable of affording it. And it became a little bit personal for me when I lost my job. Because, in this country, healthcare is tied to your jobs. Transgender community has great challenges in employment because, some of us face a lot of discrimination. So universal healthcare, gives access to like truly, healthy life, to a lot more people, to everyone. Well, I don't want to use a stereotype, but like let's say white person, white male from Midwest, factory worker who may say things like, oh, immigrants are taking away our jobs, or China's taking away our jobs. We may be farthest away from each other, but our needs are the same though. He wants healthcare. He wants healthcare for himself and his family, right? I want the same thing. I want healthcare for me, and I want the healthcare for my daughter. I want bright futures for my children. He wants that too. We are not that different, and if we can talk about that, I think we can come together.
Before the advent of managed care, as it became to be practiced by big insurance companies, most people got their coverage through even if it was through your employer, it was more often than not a nonprofit Blue Cross or Blue Shield plan. Insurance companies didn't really play any role in whether or not you get care. If it was a covered benefit, you could get whatever was being covered that your doctor said you need, and that was it. But when big insurance companies decided to get into managed care, that the world changed.
With insurance, because everybody has different plans with tiers and copays and things, a lot of the times it's cheaper to pay for a medication cash than it is by using your insurance, but the pharmacies don't tell you. So I've written a prescription, it's generic. I have a patient call me, Dr. Julie, that prescription was $200. I go on the website, the prescription is $22 cash. So why do we have a system of insurance where most of the time it's actually cheaper to not use your insurance, to just flat out use cash prices?
The fallout is that they're more interested, they meaning the corporate powers that be, the medical industrial complex is the term of art that people have begun using to describe that group of bigger and bigger corporate interests. They would rather make a sale than take care of a patient.
This is a profit-driven business. Make no mistake in that. And they are duty-bound. Duty-bound. They can be sued if they are not acting in the best interest of their shareholders. Not in the best interest of the patients, the best interest of the shareholders.
The reason for that is because health insurance companies are in the business to make money, and they will do whatever they can to avoid paying claims.
For example, let's say I want to order a CAT scan or MRI on you. The vast majority of insurance companies aren't going to just let me write an order and give it to you and go get that test. Like, I'm the doctor, right? I've already decided that you need this test by the fact that I gave you the order. But the insurance company is not going to pay for the test unless I basically call you and beg you to pay for the test. And I have to explain why I'm ordering this test. And when I'm talking to the person that I ultimately get on the phone, usually it's someone who, they're not a doctor, they're not a nurse. They really even haven't taken a medical terminology class because they can't pronounce the medical terms correctly when they're going through their checklist of questions they have to ask me. I'm often saying, what did you say? Because they're pronouncing words so wrong that I don't even know what they're trying to say. So I have to ask somebody who doesn't understand anything about pathology and the illness that my patient is suffering and go through their little checklist to basically get my patient the service that they need. So it's very frustrating that waste a lot of my time.
But these are all the downstream incentives from having this for-profit healthcare system where everyone feels like the extractive impulse comes before the kind of humanitarian impulse.
Capitalism does not work in health insurance. The marketplace does not work in health insurance. What we have in health insurance is a classic example of market failure. Well, first let me say I am a free market guy. We know what's best for us when we're consumers. We know what we like. We know what price we're willing to put into it. We make those choices all the time. We decide whether we'd rather walk or take a bike or get on the bus or buy ourselves a car and pay the insurance and drive. Those are all things we're used to trying to automatically filter through, and I wouldn't change that. But I do like to remember that the original description of market systems, which was in 1776, Adam Smith, The Wealth of Nations, gave us certain parameters by which we should judge whether market principles, the invisible hand he called them, actually will work. One of those is the buyer has to beware. The buyer has to be all-knowing. Well, he or she has to be able to think through all of the contingencies and select the right choice in the huge marketplace that's infinite out there. The second is that the seller can have no other interest than making as much money as possible from the exchange. The third principle is no one else besides the buyer and the seller must have an interest in the exchange. And the fourth thing is an observation that Adam Smith offered, which is there's an inverse relationship between price and demand in a true market. Well, the problem with healthcare is none of those apply. None of those work. There is no buyer that's bewaring. Most patients, with the exception of very few, people like myself who've trained for years, don't even have the beginnings of the clinical sense of judgment needed to decide things like, which kind of IV tubing should I have, or what antibiotic is the right one for me in this situation, or other pharmaceutical, or is this surgery that's being proposed actually one that I should agree to that invasion of my body. Most patients have no idea. They simply have to rely on the judgment of their physician. They give that over to them, and if the physician is incentivized by a market system that's profit-oriented, they could end up having their own interests, which is what a market requires them to do, and not the patient's interests, and that's a violation of the Hippocratic Oath. And we all have, to get to the third principle, we all have an interest in every one of these purchases between a patient and the healthcare system. When it's an infectious disease, that interest that we all share is obvious. If this is an active case of tuberculosis, we all have an interest in seeing that that person gets the care they need so they do not remain infectious and therefore a threat to the rest of us. But even when it's trauma and there's no infectious agent involved, we need to bring the trauma patients into a communally agreed system where we cooperate and not compete. And therefore, that group of docs and nurses is best able, who are in the level 1 trauma center, they're best able anywhere in the community to take care of those really high-risk trauma cases. That's in my interest, even though I'm not the one that's on the table. Maybe tomorrow I will be that one. Finally, price and demand are not related in healthcare. I am not a diabetic. No lowering of the price of insulin, even down to zero, makes me interested in acquiring insulin. There is no inverse relationship between the price and my willingness to demand. And that's true of all Americans who are not diabetic. They could care less what the price of insulin is. They don't want the stuff. But if you are diabetic, there is no price that's too high. You will strive to pay it no matter what, because you know if you can't get your insulin, you may die tomorrow.
The EpiPen, price gouging. Epinephrine, the medicine that's in the EpiPen, is pennies. I think I can order maybe $1.20 a vial, but I have to draw it up with a needle. And so if you're having a life-threatening emergency, you don't have time to get a vial, and you know what I'm saying? But that's like $1.50 worth of medication, and it costs hundreds of dollars. So the problem is greed.
Whether we're talking about hospitals, whether we're talking about insurance companies, whether we're talking about the drug companies, they are not existing to ensure that every life is saved and given the best care. Their main purpose is to increase the wealth of their shareholders. I cannot say that enough. I have been in the meetings. I have been behind closed doors. What they're considering is, what is the risk assessment? What is the bare minimum that we can give to people who are not insured or don't have insurance that keeps us out of litigation? That is the driving force behind businesses. It does not belong in healthcare.
Markets don't work. We have the most marketized system in the first world, and we are gasping for breath.
We are hosting a vigil for the 68,000 lives that have been lost every single year to our for-profit healthcare system. And we know that a treatment that is available would have saved their life but was unaffordable.
68,000 lives and tens and thousands more we lose annually due to the brutal, cruel, and inhumane for-profit system of healthcare that devalues and preys upon human life.
68,000 of our fathers, 68,000 of our mothers, 68,000 of our sons, 68,000 of our daughters. Not only did they leave us, but they left behind a rip in every single one of our hearts. Because they're not just numbers, they're people. They're people that had loved ones. They had fathers and mothers. They had brothers and sisters that loved them. And they were ripped from us because of our greedy healthcare system that puts profits before people. I became an activist in Medicare for All because, for the most part, I'm just a dad. But about 2 years ago, almost to the day, my son had come home to me and he had said to me, "Pops, I went to get my medicine refill today and found out that my insurance had been canceled." So I tell Danny when he came home that day, I'm like, "Okay, Danny, it's not a big deal. I'm sure we can help you out." You know, he's like, "Pops, I know I need this medicine." Words, word for word. "Pops, I know I need this medicine." I'm like, "Okay, how much is it?" He tells me it's $250. I mean, that's a big deal because we don't ever have $250 just laying around for whatever, you know? I'm like, "Okay, Danny, let's, try to figure this out. I mean, in a couple of weeks, you have an appointment with your therapist. I'm sure she can help you out. In the meantime, you should call Fidelis and find out what happened." He found out that he missed a $20 payment for a Medicaid program, and they cut him off of a medication with a known suicidal risk. On April 9th of 2019, I read a suicide note on Facebook, and it says to us, "I can't get above this pain, and I've decided death by drowning. I've superglued my seatbelt shut, double-checked, and I'm not strong enough to break it free. For those I'm hurting, I'm so sorry. Danny, Daniel, and Hazel, I'm so fucking sorry." And he drove his truck into the Mohawk River. I saw his post 32 seconds after he posted it. So I jumped in the car and I tried to race down the lake and save him. I was driving around that lake at like 65 miles per hour. This road's maybe meant for 30. Looking for bubbles, mud in the water, anything. After about 15, 20 minutes, I realized there's no way any human could have survived that long. And I had to make the conscious decision to drive home and tell my wife our boy was dead because he missed a $20 fucking payment. I vowed at his funeral that I'm going to make our lawmakers look me in the eye and see the consequences of their decisions. No human should ever be denied a medication that with a known suicidal risk or any medication because they missed a $20 payment. If me and Danny lived in Canada, if me and Danny lived in Mexico, me and Danny would still be living in Canada or Mexico.
go to work from their own 26-yard line, and they'll start on the ground. This is Justin Jackson across the 30 and out to about the 33.
He's going to get out in front of the screen. He makes the big kick-out block right there. You see the kick-out block on the linebacker, Alexander Johnson, and that opens up enough room and space for Justin Jackson. They execute him well.
My name is Justin Jackson. I'm an NFL running back. I'm a social justice activist as well as a Medicare for All activist. And my side job is kind of being a political YouTuber.
Not only has Justin Jackson thrown his political opinions into the ring, but many independent media figures consider his ideology to be one of the most nuanced out there. Joining us today is the former Northwestern running back and current LA Charger, who netted me a big win this midseason in my fantasy football league. Justin Jackson's here. How you doing, Justin?
How's it going, y'all? Thanks for having me on. I'm glad I could help you. I'm glad I could help.
And a huge reason why I am a staunch Medicare for All activist is when I was younger, when I was about 3 going on 4, my mom passed away from breast cancer. Obviously, at the time, we're just as a family dealing with all the, emotional trauma that comes with that and everything. And I'm super young, so I'm kind of not that aware anyway, right? So when I was older, I wanted to kind of probe and understand what it did to my family financially, what it could have done, because, I came from a middle-class family, 2 parents. Mom was an accountant, dad was an engineer, just middle class. And what I found out was my mom was worried about getting further treatment, a prolonged treatment because of what the strain it was putting on my family financially. She had a very aggressive form of cancer, so it wasn't a very long battle. But if it had dragged on for a year and a half, 2 years, it would have completely probably financially bankrupted my family, even though we had insurance, right? Even though we were that middle-class family. And so just looking back on that and understanding where my family was in that situation and knowing that that same thing can happen to someone who was even less, financially able as my family was, that started to get me to understand why we have 500,000 people and families that go bankrupt every single year, right? Because they don't have healthcare. They don't have they're either uninsured or underinsured, right? And once I started relating it to my family and what could have been, that started to make it very real for me. Could my dad have paid for, having 3 kids, all of us playing sports, right? Would I have had the opportunity to play football at all? That might have never happened. I might have not be sitting in this seat right now today, right? And just because of what your cells decided to randomly start, attacking your own body, right? That's the little thing that can change someone's whole life that much. Well, no, not everywhere, but in this country, yes, that is the reality, and that's the reality for a lot of families. Now, the reason I get that help and the reason, I have great health insurance under my job is because there's money in it, right? There's money in me being taken care of. There's money in someone rushing out to the field and making sure Keenan Allen or Austin Eckler is okay, right? Because that person, that individual is making money for the system as a whole and for the individual in getting back to playing very quickly.
Keenan Allen with his first of the night, and Allen is slow to get up. Well, it's an all-out.
Now, there's actually not an incentive for a company to rush in and get you care when you need it. In fact, it's the opposite. The incentive for the health insurance industry is to make sure that if you're sick, they can find a way to cover you less or not cover you at all, because that's going to affect their bottom line. And that's inhumane.
There you go. Let's dump it. Let's see. We'll put back what we don't want.
Dump it.
There you go. There you go. Show the needles.
It's really frustrating because kids are dying, like Dan Strong and my son Willie died in 2007 because he had a brain aneurysm, but we had asked our insurance before when we found out that he had a brain problem for insurance coverage to get more tests done, and we didn't get that insurance coverage till after he died. Yeah. People are dying.
That's exactly what happened with Danny. When Danny found out he had lost his insurance, it was because he was medication, which is the way many people learn that they lose their insurance. He called them on April 1st or April 2nd, and that's when he found out he missed the $20 payment. He made the payment that day, and they told him that his insurance plan would be reinstated on the next billing cycle of May 1st. It was a week later that he committed suicide.
Wow.
Although his insurance was reinstated May 1st after he was dead.
Oh, that's sick. Yeah, it is.
It's like we have no time to lose. You know, this is a slow process, but it just makes me so sad because people are dying while we're waiting for insurance and Medicare for all and everything.
So one of the obstacles I keep seeing are people like my parents. They're happy, you know, they're happy with the system. There's a lot of people out there who do fall into that category, or happy with the way things are.
Yeah.
How do we cross that bridge and get them to understand that this isn't good for everyone?
Well, I think you need to convey that this is not to take away anything from you. If you like your doctor and want to keep your doctor, if you like the ability to go see any specialist without having to get a referral, whatever you like about your plan, you're going to be able to keep it with Medicare for all. But in the United States specifically, we have this more every man for themselves mentality. We don't have a sense of community wellness. Right? It's more of a selfish take, you know, pull yourself up by your bootstraps. And so we don't believe that it's possible for everybody to have this Cadillac plan or this good plan. We don't believe that that's a possibility, but it is, and that's the way it should be. So we're not taking away anything from people who like their health care. What we're doing is expanding it to everyone, and we can afford to do that. And it's actually going to save us money to do that.
It is often suggested that America simply can't afford single-payer health care. But that's not what the actual numbers tell us. Here is how much other nations currently spend per capita to provide universal health care to their citizens. In the U.S., the government already spends a similar amount on a system that is neither free nor universal. This spending is funded by our taxes. Then an additional $4,000 is spent by the insurance industry. This spending is funded by our premiums and subsidized by our taxes. And still an additional $1,000 is spent directly out of our pockets. This is the cost of the profit motive in healthcare. A single-payer system would eliminate all payers except for the government and would eliminate the profit motive. In other words, we can afford to do what these other nations are doing, and we can do it by spending far less than we spend now.
People don't understand the power that unnamed, unseen insurance company bureaucrats have over their lives, nor do they understand how much power insurance companies have to even determine whether or not you're going to get a treatment or a medication that your doctor says you need. I worked for 20 years inside the health insurance industry. I worked for Humana and Cigna. I rose up through the ranks and was leading corporate communications for Cigna. I was the company's chief spokesman, and I got a lot of visibility into what motivates the executives, handling what we referred to as high-profile cases or horror stories in which people would go to the media and complain about not getting coverage for care that they needed. So I was on the front lines of dealing with those situations, trying to persuade reporters not to do those stories, trying to convince reporters that, you know, there are two sides to the story. In many ways, it's an anti-reporter. And it became easier and easier for me to be that person over time. At the beginning of my career, before email became so prevalent, I actually had to talk to reporters on the phone and answer questions. And as time went on and everybody switched to email, we became much more in the driver's seat of dealing with the media. But I, as part of that, became very much aware of what my company and other companies did to avoid paying for care that people enrolled in health insurance plans, what they were facing. The one that is most memorable was the last one that I handled. It involved a 17-year-old girl in Los Angeles. Ultimately, she needed to have a bone marrow transplant and then a liver transplant for this girl. Her name is Nataline Sarkeesian. Cigna refused to pay for the liver transplant, even though her doctors at UCLA Medical Center said they were fairly confident. In fact, they even put a percentage of 66% likelihood that she would survive the surgery and live at least a few more years, and probably longer, if she had the transplant. But a medical director 2,500 miles away who worked for Cigna in Pittsburgh said he didn't think it was medically necessary or medically appropriate. Well, the family, they were just astonished. They didn't have any idea that Cigna could have a role to play in whether or not their daughter would get a transplant. They knew their policy covered transplants. They knew nothing about the way the system really works. They decided to appeal that denial. Didn't work. So they decided to go very public with what was going on, and they went to the media. It became a real PR problem for Cigna. I started getting calls from reporters in LA and throughout California, and then it just snowballed. National networks were following this, international networks were following this. At one point, the family was having a protest in front of Cigna's regional offices in Glendale, California. And I apprised the CEO and other executives that this was happening, and a meeting was arranged very quickly, and a decision was made quite quickly at that point to reverse that denial. But this was a few days after the transplant was to have taken place. Keep in mind that a perfect match had been found, the surgery had been scheduled, but it had to be canceled because Cigna wouldn't pay for it and the family didn't have the money to cover it. When Cigna agreed to do it, I thought, wow, this is something good that I've been a part of, and Nataline will get that transplant. The problem was that so much time had passed. Even just a few days can make a world of difference when you're that sick. Her other organs began to shut down. She died just a few days before Christmas in 2007. It was an emotional roller coaster. I can't even imagine what it was like for the family. But even for my staff and me, it was something like we'd never experienced before. I couldn't help but feel in a certain way, the pain the family was feeling. I'm a father myself, and when she died, I just said, I can't do this anymore. I can't be a spin doctor. I can't try to put a face on this that's not real. So I turned in my notice pretty soon after that.
Nearly every American, regardless of politics, has either been affected directly or knows someone who has suffered the consequences of the for-profit system. As a result, healthcare is no longer the divisive issue it once was. According to polling conducted by Fox News, approximately 70% of Americans support switching to a universal healthcare model. In light of such overwhelming popularity, one is led to ask, why is nothing changing? The insurance companies are only half of the problem. The other major obstacle to healthcare justice is not the American people. Rather, it is America's elected officials and the billions of dollars spent to keep them in power.
Everybody in? Nobody out! Everybody in? Nobody out! Nobody out! For-profit healthcare's got to go! Hey, hey! Ho, ho! For-profit healthcare's got to go! Founder of Red Berets Medicare for All and board member of Full Washington. Yes. It is my great honor to introduce the amazing, incredible Laura Fielding.
I just want to say that these berets are
thousands of stitches. Every single beret is intentionally created for national improved Medicare for all and healthcare justice efforts around this country. The first Women's March, right after Trump's election, planted the seeds when I saw all the millions of pussy hats in the streets. I started knitting these after seeing all of the hats for the Women's March. But what has happened, fast forward to now, we still don't have health care.
The main reason why we're not where we need to be is because of money in politics.
I'd like to draw everybody's attention to the flag. That flag has been all over Washington State for the last 3.5 years. That flag lists nearly every single country that has achieved universal health care or a single-payer system and the year that they achieved it.
Our Congress is corrupt, our president is corrupt, and Joe Biden is also in bed with the giant insurance companies. He actually took more money from the giant insurance companies than Donald Trump, just to give people an idea of that it's not just one of the parties that's been corrupted by corporate money, it's both parties. We live in a corporate duopoly.
And you can kind of see it start to happen in front of us as people like Biden and Kamala Harris tweet, healthcare is a human right. They tweeted healthcare is a human right in 2020, even as Joe Biden said he would veto Medicare for all if it came across his desk.
It is absolutely a disgusting travesty that the Speaker of the House will not schedule hearings, public hearings, and fight to save these lives. That's right. And Nancy Pelosi and all of her colleagues, Democrat and Republican, have excellent health care. They have the best health care that our tax dollars can buy.
Shame.
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 Shame on you, Pelosi.
Shame on you, Nancy Pelosi. If she's denying people health care justice, she's complicit in the murder of 68,000 people across this country every fucking year.
I can't receive a lunch from a pharmaceutical representative because that might influence my prescribing habits. But you can be someone who is elected by the people to represent them, but you can receive donations from corporations. It's just not right.
The Democrats and the Republicans are both in the pockets of Big Pharma and the insurance lobby. They work together to deny all of us care.
Last year, at the height of the COVID pandemic, what I hope is the height of the COVID pandemic, both Kamala Harris and Joe Biden tweeted out, said that it is unconscionable for anyone to have to pay for a COVID vaccine. It's unconscionable. There's a shared public interest in everyone getting this vaccine and everyone having the ability to get us to herd immunity. Why would you withhold something from a person, a vaccine from a person that could save their life just because they don't have the ability to pay? I was pretty thrilled to see that. And I asked the obvious follow-up question. Right on. That's correct. And how is it any different from people who have diabetes? How is it any different from people who can't afford their cancer treatment? How is it any different from anybody who is in a car accident and can't afford treatment for their injuries?
Think of all the Americans who are scared to call their doctors and scared to go to the ER when they're sick because they're scared of what the bill will look like.
Can you imagine the mothers out there who are out there right now who cannot take their children to see a doctor?
Ultimately, everything's about the dollar bill, right? So when you have Big Pharma, when you have these mega health insurance companies who basically run Washington, D.C., who basically write the bills for our politicians, and when they need that money to get reelected, of course, it's a conflict of interest. It shouldn't happen.
This should not be an industry that's for profit. It should be an industry where people can get the best healthcare in the world and where they don't have to worry about going into medical bankruptcy for that. And again, everyone in this country could have healthcare if it wasn't for these giant insurance companies and the corrupt politicians, both Democrats and Republicans, who are in the pockets of these giant insurance companies.
My point is, if you've got a passion for healthcare reform, try to get passionate for saving our democracy and ending the influence of big money.
I did not grow up with the reality or the fear of not being able to see a doctor. And I think that is what is so cleverly hidden in this country. There are so many people that just don't know. They are not awake, they are not aware of the realities that people are dying. We should be knitting, crocheting, sewing, painting, whatever your medium is. Woodwork. We should be doing this for healthcare justice, for national improved Medicare for all. Hear, hear. And so that's what we're doing. It's a labor of love. I would love to see some of these crafters that knit all of those hats that were across not only this country, but the world. Please join us and help us join all these developed countries that have had healthcare as a human right for decades. That's what our demands are. Thank you very much.
The fight for healthcare is bigger than partisanship. There is no us versus them when it comes to cancer or diabetes. Our mortality unites us all, black and white, queer and straight, liberal atheists, and conservative Christians.
The Old Testament prophets are very clear about the need for governing elites to take care of the sick, the poor, the stranger, the widowed, the orphan. They repeat this over and over again. These Old Testament prophets, either in retrospect or in foresight, are saying to the people of Israel, if we don't look to these people, if we don't take care of everybody, if we don't put hands on and make sure everybody has what they need, then we cannot exist. We are not a strong society. We cannot exist, and we will be subject to defeat. This is one of the things that Jeremiah said. For the hurt of my poor people, I am hurt. I mourn, and dismay has taken over me. Is there no balm in Gilead? Is there no physician there? Why then has the health of my poor people not been restored? Now, Jeremiah knows there's a balm in Gilead. Gilead is a place. It existed then, and there was a special plant that provided a special balm that everybody knew about. He knew that it was there, and he knew that there are physicians also who could apply that balm. So he wasn't asking because he didn't know. He was asking because he knew it was there, and he knew they weren't doing what they needed to do to make sure that people got access to it. I think that could be clearly applied to modern-day America. We know there's a balm in Gilead here. We know how to take care of people. Clinical science has been, in large measure, developed in the United States over the last 50, 60 years. But we're not helping people. For the hurt of our people, we are hurt. We're full of dismay because we are not restoring the health of our people. Those are clear teachings of the Old Testament that don't just recur among these guys. Many prophets talked about it, and the history is full of circumstances when the governing elite ignored this, and it was to the detriment of their society.
We're at a real tipping point.
The people in this country know the system is broken. They may not understand exactly how badly it's broken until they have reason to experience it firsthand, but they know that we need change. And we see poll after poll that shows that there's majority support for Medicare for all.
We are living through a global pandemic, and we still don't have universal health care.
COVID has really exposed the extent to which a lot of the arguments against universal health care were bupkis. And now even corporate Dems are in this uncomfortable, squishy position where they have to admit the ethical failings of the for-profit system. If there weren't ethical problems with the for-profit system, they wouldn't be advocating for something outside of that system for COVID. Now, the reasons they think that COVID is exceptional are obvious, right? They need the country to open up. They need the economy to keep going. If a smattering of Americans are getting cancer here or there, that doesn't affect the bottom line the way that an entire country shutting down because of this airborne disease does, right? But they can't say that. They can't admit to that. And so they're a little bit under pressure to contend with the ethics of the argument that they're making, and to be pressured to universalize that argument beyond the scope of COVID. And so what I would like to say to folks is to not lean off, not take your foot off the accelerator, and to continue to force that logic that's being expressed by even corporate Democrats to its logical conclusion.
We are up against a massive corporate interest, like never has been seen in the history of the country before. $4 trillion a year revenue, that's a lot of money. That's huge. They have all those resources, which they can then turn around and deploy so that they can maintain the status quo. They don't want to give up their profits. It's that big. This is the hill we have to climb. This is the major political lift that's facing us that is unique and new and different, why no one has written a script that helps us figure out how we're going to get from where we are to where we need to be. The status quo isn't sustainable. There is a brick wall that our economy is speeding towards, and it's going to crash. What we have to try to do is prevent the crash. But if we aren't able to do that, the crash will still come anyway. Sooner or later, change is going to happen.
For too long, we've accepted the status quo in this country. We've accepted just breadcrumbs from these corporations and from our government. And it's time for the people to rise up and say, no, we deserve better. We are worth better.
It's important to not lose hope. I believe this pandemic is going to bring about change. And I would like to encourage people to support and to partner with local activists and support them and to uplift them and to amplify their voices. Because again, I wholeheartedly believe we need this on a national level. But if one of the ways getting there is to start it on a state-by-state level, that's something that we absolutely need to invest in so that it can expand to all states.
There's some who say that the states can't pull this off. It has to be done at the federal level. I don't necessarily buy into that. I think it could happen. One state can, I think, ultimately pass a single-payer bill, implement it, and other states will notice.
One state is going to open the floodgates first. We don't know which state, and every single healthcare justice activist out there is going to just cheer and just because it's going to then make it that much easier for the other states to come and break through. And I just want to talk about the power of what we're about ready to be engaged here in Washington State with Whole Washington with the Direct Democracy Ballot Initiative. Is a ballot initiative has the power to bring people together through the states.
It's important to keep, I think, the pressure on members of Congress and candidates who run for president, that we need more and more members of Congress who are supportive of this. But it doesn't mean that we should dismiss the efforts in the states. I think it really can happen in the states. And there's not a lot of attention focused on it, but states like Washington, California, New York, others really have strong advocacy support. So I think it could happen in Sacramento, it could happen in Albany, but there is strong support for it, and I think it can happen. So I support anybody's effort, whether it's their focus on Washington or the states, and I encourage people to broaden their support for both.
Change in America has actually never happened at the ballot box. Change in America happens when everyday people rise up and protest and build movements and demand rights. We saw women, demand the right to vote. We saw Black people in America fight back against Jim Crow laws and demand equal rights. The gay marriage fight for marriage equality. And now we're seeing people rise up and realize that if we want everyone in this country to have health care, that we're going to have to rise up, the people are going to have to rise up and demand that health care be a human right.
Any huge changes that have been accomplished in this country, and probably everywhere in the world, have been people-powered. I believe in people power. I think we can do this, and by doing this, I mean that people, you and me, we should do anything and everything on our own way and doing what we can do to realize healthcare for all in this country. I think it has to be people powered. We must do this.
The thing that makes me optimistic is, one, the hard part of convincing millions of people and the overwhelming majority of Americans to be on board with this program is done. People are on board. The stage is set. We're ready to go. And I think there is some need to strike while the iron's hot. When I'm thinking about accountability mechanisms, I can't ignore the power that comes with a certain democratization of the media that comes through social media. The ability for us to all communicate with each other and have these really organic campaigns. Last summer, we saw the biggest protest movement in American history, more bodies in the street, not just here, but across the world, because of the video of George Floyd being murdered. It does sometimes feel to me like it's going to take a kind of groundswell from the masses that's not necessarily traditionally organized to have the effect in the short term that we'd like to see.
We can make this heavy political lift, that we can do this. Let us put single payer on state ballots everywhere in the country with ballot initiatives, state-based single payer proposals, or into the legislature if you don't have a ballot initiative. You can access your own local representatives and you can make your own ballot initiatives happen in your state. Bring this issue to your community and start acting on it. Now you're going to run into barriers. You're going to run into politicians of both parties who are going to oppose you. And that's the next thing I'm going to tell you to do. Vote them out of office. I don't care which party you usually vote for. We've got to gore those oxen. That's what we have to do. Be convinced that the ballot makes it possible for you to make this happen.
If you are always willing to vote the lesser of two evils, what that means is that you're always going to get the lesser evil every single time. And I think people are going to have to start to look inward and ask themselves if they're willing to keep doing the same thing over and over again and expect a different result. There's never going to be a different result. Something has to be different. Because Medicare for All, with 88% of Democrats and 49% of Republicans and 70% of Americans overall, is an American policy.
Do we think it's possible to say and feel like and mean that we live in the United States of America? I've been really struggling with my belief as to whether it's possible to heal this country, whether it's possible to get a healthcare system that is fair for everyone, but that's what it would mean. That's what it would mean for us to do this. It would mean that we really have to come together. Yes, we would have to come together and heal enough as a society to come together to demand this.
We have to have a global effort to ensure that everyone is taken care of who has health issues.
Despite all of our differences, we all have this fundamental need. We all have this fundamental right, and it's to have human dignity and be able to live. We have a right to live. We have a right to live. I think we are struggling with a crisis where we don't really know if we have that right. There's no other explanation. We are struggling with some kind of fundamental lack of belief or lack of faith.
We learned that when you love, when you care, when you do something that's magnanimous and generous and you reach out and help people, it heals you. It brings you together.
We deserve this, and we can do this, and all we have to do is put aside some of our differences and say, it's going to take us coming together to demand this, and then we can.
I really believe that we will see this in our lifetime. I know it can be frustrating that, it wasn't done yesterday. I mean, I'm in this fight now, I'm going on my 7th year, but we are closer than we've ever been. It's gonna take a lot of hard work. And remember, again, this isn't left versus right. This is us as individuals, as people with families, people with loved ones. So it's all of us together. We're all in this fight together.
I do this not for my benefit so much anymore as to try to make sure that we fix this for other people and people now and down the road. I'm doing this for my kids and grandkids and for you and for everybody else in this country. Don't give up hope and don't give up the work and the advocacy. Just know you're going to have a David and Goliath situation on your hands, but David can win.
We hold these truths to be self-evident, that all are created equal, that all share certain unalienable rights, and among these is the right to life, the right to live, to breathe. The most fundamental promise of America is that we deserve to exist so that we can enjoy liberty and pursue happiness. Now is a time when that promise is in question. The nation is wounded and divided. But the mother of exiles still raises her lamp and whispers, "Are you ready to heal?"
When we start doing this great thing of bringing health care to every American, we will make that moment of generosity happen and help to heal the wounds and the fissures that are currently in the body politic of the United States of America.
Together we can save more than our broken bodies. With this cause, we assume the power to heal our nation, heal our people, heal our democracy, heal our families, heal us.
Save me. Could you save me one more time? You know you loved me. Could you love me all the time? Yeah.